The first guideline in Chapter 19 is application of 7 character. Application of the 7 character is based on whether the patient is undergoing active treatment and not whether the provider is seeing the patient for the first time. There are 3 7 character value with the exception of fracture. A. Initial encounter is used when the patient is receiving active treatment. D. Subsequent encounter is used when the patient has completed active treatment and is receiving routine care during the healing phase. And S. Sequela is used for complications that arise as a direct result of a condition. The definition of injuries is a damage to your body. It is a general term that refers to harm caused by accident, fall, hits, weapon, and many more. This injury range from minor to life-threatening. Injuries can happen at work or play indoor or outdoor, driving a car, or even walking across the street.
In Chapter 19, there are 12 types of injury in the coding guidelines, such as injuries to the head, injuries to the neck, injuries to the thorax, and others. These are the risk factors of injuries, which are gait disturbances, bone or joint disorder, alcohol and illicit drug use, aggressive or violent behavior, failure to use automotive seatbelt, and refusal to wear recommended protective equipment and headgear. Next, the signs and symptoms of injuries are pain, joint swelling, lacerations, tissue swelling with or without discolorations, and reduced mobility.
Next, I will continue with the cause of the injury. Anything that can damage the body can cause an injury. Injury can be accidental or intentional, as in the case of violence, impact at high speed, force, animals or insect bites, fire or extreme hurt, and exposure to the chemical and toxic. Next, for the coding guideline injury. For the coding guideline injury, you have to code as many codes as you can. For the code T07 should not be assigned unless there is a specific code.
Next, we move to superficial injuries. The guideline for superficial injury is they are not coded when associated with more severe injuries of the same site. The example for superficial injuries are abrasions or contusions. Next, the guideline for primary injury with damage to nerves or blood vessels is when the primary injury is nerves or blood vessels, the primary injury is sequenced first and will be followed by the additional codes from injuries to nerves and spinal cord, such as code from category S04, or injury to blood vessels, such as code from category S15. In terms of iatrogenic injury, the guideline is if the injuries occur during or as a result of medical interventions, codes from category Chapter 19 should not be assigned.
Lastly, for the case study about the patient was beaten. He is not sure whether the raccoon or the dog beat him. The patient's left forearm has bit mark on it. The code for this case is S51.852A. Open bite of left forearm, initial encounter for the close fracture. Alright, that's all from us. Thank you.